This session and the entire day, to me, culminates an entire year and 8 months of a lot of effort and a lot of work. A lot of great things have happened in Mississippi since then, but I think earlier you heard the macro representation of all of our efforts, but we're going to get into some of the nuts and bolts, and you'll hear the micro representation of all of our efforts. But a little bit about the firm. You'll see that Butler Snow started in 1954, and I have to do this. We've grown. Butler Snow's grown and grown and grown, and I'm very, very pleased to be a member and a part of the Butler Snow firm. And you can see our footprint throughout the Southeast, and growing. Actually, we just started a new London office, so Butler Snow is now international. And those are some of our practice groups, as you'll see. And I'm in the Public Finance and Incentives group, and I'll be doing a lot of economic development work at Butler Snow, and with particular emphasis on this area, economic development and healthcare zone incentives. So where are we? You know, this legislation started, as the governor said, with his trip to Texas in 2011, right after he was elected governor. It was November 28th and 29th, and he took that delegation there, and he saw everything that Dr. Wernerdy talked about, everything that many of the individuals that you've heard from already, what they've talked about. And on my first day of work, there was a one-pager with bullets, and it talked about health zones, it talked about incentives, and all of these great things that he wanted to do based on that trip. And we took that and we expounded it in something that I think is pretty great and it's pretty dynamic. And as you can see, on the evening of April 29th, it was a late night, but we got the conference report filed, and what we had then was a bill that we were going to take to the governor that he was very proud of, because this was his initiative. This is something that he, as the governor, set the benchmark for in terms of economic development from a healthcare perspective and pushing that initiative. So it was signed on May 14th of 2012, and we got to work. So what is this about? Why all of this effort and focus on hospitals and zones and hospitals being the nucleus? As you heard earlier, the real emphasis and focus is on using hospitals as the anchor. And it's not necessarily about growing more hospitals in Mississippi or building more hospitals, but quite possibly that could be a part of it. But the real meat and potatoes, the real thing that we're going after is that industry that supports the hospitals, the machines that are inside hospitals, the laboratory equipment, the white jackets, the surgical equipment, everything that makes that hospital function and exist is the driver. It's something that will grow Mississippi and create jobs, value-added jobs that we think will push this economy forward. So those are the necessary services that we want to push and promote. So why acute care beds? Again, it's focused on the hospital. You know, as we talked about Tupelo, one of the largest rural hospital in the nation. And in many of your communities, as you'll hear from mayors and other economic developers, you will see that sometimes the hospital is the largest employer in that particular community. And that's a good thing. We need to use that and build upon that great asset that we have in Mississippi. This particular video, there's a lot of questions about the bill. I mean, how did it come about? Why did we do it this way? Why do we pick 375 acute care beds? Is that an arbitrary number? There was a lot of logic to it, but as you all know, the legislative process is an animal in and of itself. And you have a lot of brilliant minds all working together to form what we signed there on May 14th. And if we could play this video, you'll see that Willie Simmons, my dear friend, offered this amendment, and at the time, I'm sitting in the gallery listening to it, and my heart's beating like, oh my God, the bill, what's going to happen to it? But what he did was actually ingenious, and it precipitated the healthcare zone master plans that the governor talked about, that you'll hear some of our mayors and some of our economic developers really go into a lot of detail about.
We offer this amendment in hopes that it would improve the bill, and the amendment simply says that where you have 3 counties that's contiguous to each other, and those counties then would reach the threshold, those medical facilities would qualify for this kind of investment. We think it is good. They may never do so, but at least it gives them something to work toward.
So, maybe it will, maybe it won't. No, I think it will. I mean, he said it might not do so, but as of today, we've got 12 communities in Mississippi that have healthcare zone master plans. You've got 12 mayors, 3 of them who will be represented today, who are going to put forth the effort, who are going to follow the vision of Governor Bryant that he has laid out to say that, look, we can create jobs using healthcare as an economic driver. And I think it's particularly illustrative of this entire concept. So let's talk a little bit more about the Mississippi Healthcare Industry Zone Act. Yes, it is 375 beds. Initially, we enumerated 8 counties in Mississippi that had that large threshold bed count. And the focus and the goal was, look, we want communities that have large hospitals to be the ones that would be the front runner to go out and do the mission of economic development from a healthcare perspective. But with Mr. Simmons' amendment, what we realized was we were leaving out other rural communities that can also go out and grow Mississippi and our economy. The perfect example is Madison County. Madison it only has 64 acute care beds, and it's contiguous to Hinds County and Rankin County, which has a plethora of beds, way over 375. But given that the way the initial legislation was set up with only 375 beds being the requirement threshold, they wouldn't be able to participate. But with the 3 contiguous county rule that Mr. Simmons offered, Madison County now participates in the healthcare zone. There is a 5-mile zone or corridor around the hospital there in Canton where you have embedded incentives that have particularly been used for, the things that we've always incentivized, the automotive industry, energy, polymers, aerospace. But given the governor's vision that healthcare is an industry that we can support from an economic development perspective, you now have communities like Batesville, communities like Holly Springs that are all working collectively together to push this from an economic development perspective. I'm going to go back for a second. The bill passed in 2012, but we tweaked it. We worked on some things. We figured out, based on the study that was released in 2012, there were ways that we can improve it. You'll see in the first bullet there, it's talking about a great community called Tradition. It's a master plan community, and it's one of the only communities in the state that is a healthcare zone that's not anchored by a hospital. But what it is anchored by is an academic research center or an academic center that ultimately will do the mission of growing these synergies, growing companies that will do innovation, that will commercialize that innovation and that research. And I think they're going to do great things at Tradition with respect to Diabetes Foundation Center, with respect to MGCC building a simulation center. So there are a lot of things that are going to come out of the ground as a result of these great incentives in Mississippi pushing this from a healthcare perspective. The second bullet there you'll see, it is about growing companies, it is about healthcare, but at these universities you also want to incentivize housing. You want to find a way to build either affordable housing or sometimes mixed-use development. So there's also synergies. When you have a large mass of people there on a campus, you want to build things that allows them to shop, to do their groceries, to live, to play, all within that base. So we tweaked the bill, and that's what you see in House Bill 722. The financial incentives, they're the same as they've always been with respect to MDA's incentives. The accelerated 10-year state income tax depreciation deduction, sales tax exemption. We've always had that, but we've never had it for healthcare and the healthcare industry, and we've never had it for a $10 million investment or 25 jobs with respect to healthcare. And then you've got the property fee in lieu or the tax abatement. So these are the tools, as Brent Christensen would say, the tools in our bag that we use to go after industry, and I think we can do it. One of the great things that we did through the Mississippi Home Corporation, we created something called the Mississippi Healthcare Industry Zone Act Affordable Housing Program. And what this program did, it created healthcare zone master plans, and these are very elaborate plans. These are plans that an American Institute of Certified Planner has to put together. They have to have experience in Mississippi, and it promulgates all of these requirements that really gives a mayor, it really gives an economic development practitioner in that community the tools that they need to really go out and go after this industry, whether it be a pharmaceutical company, whether it be a distribution company that does healthcare, whether it be biologics, whether it be shared services, which is what we want to see more of in Mississippi with respect to laundry centers or food services. The mission of a hospital, to me, should be treating the patient. It's not necessarily to wash clothes or to provide food for the patient. That could be something that we can incentivize and create jobs through the Mississippi Healthcare Zone Industry Act. So you'll see on the next slide, and what the governor mentioned, all of these requirements that these master plans have to unveil and have to go through. And it's quite extensive. And the mayors that you will hear from in just a few minutes, they're going to talk about the profile of their community, talk about some of the successes of their community, but you're also going to hear them really support the governor's vision, because I think it's something that can work. I think it's a target area that is really that benefits Mississippi from a holistic sense. I think it's something innovative. I think it's something that other states aren't doing from a comprehensive statewide approach, and I think we can really succeed. There's my contact information, and I'm going to call up the next panel, let them get seated, and I'm going to introduce everybody, all of the mayors and the economic developers. Thank you.